A cervical screening test is known as a CST. It is a simple test used to check the health of your cervix. The cervix is inside your body at the top of your vagina, and it is at the lower part of your uterus or womb. Cervical screening looks for the presence of the Human Papilloma Virus, also known as HPV, which can lead to cell changes in the cervix. HPV is a common sexually transmitted infection, also known as an STI, passed on by genital skin-to-skin contact, which usually shows no symptoms. There are many types of HPV, and it can infect anyone. Some cause genital warts, others can cause cancer. Almost all cervical cancers are caused by HPV. The HPV vaccination is a safe and effective way to protect everyone from HPV. Within Australia, the HPV vaccination is free to anyone between 12 and 25 years old. Even if you have had the HPV vaccination, it is also important to have a cervical screening test every 5 years if you are a woman or a person with a cervix between the age of 25 and 74 years old and are or ever have been sexually active. There are two ways a cervical screening test is performed. The clinician-collected test is when a doctor or women's health nurse uses a small instrument called a speculum to gently open the vagina and collect a sample using a small brush. For some, this part of the test can be a little awkward and embarrassing. Just remember that this is a common test that most women or people with a cervix have, and for the doctor or nurse, it is a very normal part of their job. If you're feeling any discomfort, communicate this with your doctor or nurse, and know that the test can be stopped at any time. Self-collection is also an option. This is when the client takes their own sample with a long cotton swab under the supervision of a healthcare professional. The client is given instructions on how to collect the sample and provided with a private place to complete the test. It usually takes around 2 weeks for your healthcare provider to get your cervical screening results. If HPV is not detected, you do not need to retest for another 5 years. If HPV is detected, your doctor will provide guidance on your next steps. All cervical screening tests are free under Medicare. However, your clinic may charge a standard consultation fee. You can contact your local medical practice, community health centre or women's health clinic to book an appointment to have a cervical screening test. If you would like assistance to find and book a cervical screening service that suits your needs, the Cancer Council can help you. Cannot remember if or when you have had a cervical screening test? You can find this out by checking the National Cancer Screening Register online via your MyGov account, calling the National Cancer Screening Register, or asking your healthcare provider to check the register for you. The National Cancer Screening Register will also send you a reminder letter in the mail when you are due to retest. Cervical cancer is one of the most preventable cancers and can be prevented through a regular cervical screening test and the HPV vaccine. What are you waiting for? If you are due to be tested, book in today. For more information on the services listed in the video and other cervical screening resources, see the video description.